Montgomery County Coroner's Office wants you to be aware of a drug that is resistant to Narcan.
And it's showing up more frequently in drug samples and overdose deaths. 2 News reporter Riley Phillips joins us live in the studio, digging deeper into this issue. Riley.
Xylazine was found in 15 suspected overdose deaths in the month of January, but that's not the only drug the coroner's office is concerned about. They're also seeing a reemergence of valeryl fentanyl.
Valeryl fentanyl is what's considered a designer opioid or a opioid analog.
Valeryl fentanyl causing concern once again in the Dayton area. The Montgomery County Coroner's Office saw a spike in the drug back in 2019 and 2020, and now they're seeing a similar trend.
For about a year and a half, it pretty much disappeared. We pretty much had mostly fentanyl was the primary opioid that we were seeing in samples, at least as far as ceased drug samples go. And then in the last here in 2023, it has reappeared now.
It looks and does the same as fentanyl, although they're still researching its potency. The coroner's office is also seeing an increase in Xylazine, which is used as a veterinary anesthetic. It also looks like fentanyl, but it's dangerous because it reduces the effectiveness of Narcan.
The difference is that it produces effects similar to the opioids like fentanyl, but it does not. Narcan is ineffective with Xylazine because Xylazine is not an opioid.
With Narcan use encouraged to help prevent overdose deaths, advocates are worried about this spike in Xylazine. The Montgomery County Alcohol, Drug Addiction and Mental Health Services Board is reminding people of other ways to prevent deadly overdoses.
We are doing harm reduction, which means encouraging people to not use substances when they're alone. We don't want people to use substances ever, but if they're going to, we want to make sure that somebody can administer Narcan or call for help if that happens.
And Adamus has a 24/7 hotline that can help people before they even turn to drugs.
If an individual calls the crisis call center, they will be immediately connected with a provider, meaning someone who is a therapist who could talk to them, a peer support specialist who can talk to them if they're specifically struggling with a substance use disorder.
And the number for the Crisis Now hotline is 833-580-2255. The Montgomery County Coroner's Office also wants to remind people not to share needles and to stay away from drugs that look like fentanyl. In the studio, Riley Phillips, 2 News.